Good morning, sir. My name is Jusner Mahino, a student nurse of Ifugao State University, and I am going to perform an interview on the assessment of the Family Health Diary. And to start with, we need a client.
Good morning, sir.
Good morning, ma'am. So, to start, we need to give a client privacy. Okay. And then perform hand hygiene. Explain the procedure to the patient. Okay, ma'am, I am going to interview you and to get your family health history and then other cases. So you may sit down, ma'am.
Thank you, sir.
Okay, so are you in a comfortable position?
Yes, sir.
Okay, so we will start now on your interview. Okay, so what is your name, ma'am?
So, I'm Rosalie Chase.
Rosemary Chase. And your husband name?
J. Chase.
JJ. Okay. Okay, so do you have an ethnic name? Okay. So, Waday palayaw mo?
Wala naman po, sir.
Okay, so, wala. Yung asawa mo may palayaw?
Wala naman, sir.
Okay, yung blood type nyo?
AB, sir. AB positive.
Okay, AB positive. And your husband?
O positive.
Okay. So what is your religion, ma'am?
Roman Catholic.
And your
Same with
husband?
my
Okay. So, what is your educational attainment from?
college graduate.
College graduate. And your husband?
Same too.
Okay, college graduate. Your occupation, ma'am?
He's a housewife.
Okay, housewife. And your husband?
Working in a company.
Okay. Okay, so what is your nationality or tribe?
Filipino.
And your husband?
Same.
Okay. What is your age at marriage?
25.
And your husband?
Same.
25. Okay, so place of marriage. Where did you have your marriage?
Barangay Katangahan.
Okay.
Lima Berbero Pan Street.
Okay. So, what your address?
What?
Your house number?
Banawe, 143.
Okay, the street. The Puro.
5.
And then barangay.
Haba.
Municipality of Davao. Your contact number, ma'am?
0935-227-2747.
0935-227-47. Okay, the source of household water?
Spring.
Spring. The type of your toilet use?
Flush.
Flushed. Okay. So I'm going to get your record, ma'am. So if ask me if kung meron kang sakit na ganito. So meron ka bang tuberculosis from the past
None.
and then the present?
None.
Heart disease,
None.
diabetes,
None also.
hypertension,
Wala po.
bronchiasma,
Wala po.
urinary tract infection,
None.
hepatitis,
None.
measles,
None.
chickenpox,
None.
rubella,
None, sir.
malaria,
None.
parasitism,
None.
goiter,
None.
tooth decay,
None.
and do you have anemia?
None.
Do you have medications?
None.
Okay, so previous operations or surgery.
None, sir.
Okay, do you smoke?
No.
Okay, so do you take alcohol?
No.
Substance abuse like marijuana or drugs?
No.
Okay, no exercise?
Yes.
Okay. So poor nutrition?
No.
So exposure to chemicals like pesticides, lead, mercury, cyanide.
None.
Okay. So let's now move on to the other. Okay, so what is your age now, ma'am?
26.
26. Height. Okay, do you know your height in centimeter?
151.
Okay, 151 centimeter. So when is your last menstrual period?
February 25, 2022.
February 25, 2022. Duration of your last menstruation?
3 days.
3 days. Okay, the expected date of delivery is November 2, 2022, ma'am.
Okay, sir.
Okay, so order of present pregnancy, first trimester. Okay, so OB score is G1PO. Okay, so do you have weight in kilogram?
50.
50. Date of prenatal visit, November 4, 2022. So, ma'am, I'm going to get your blood pressure to check if it's normal. Okay, ma'am, your blood pressure is 120/80 and that is normal. So I'm going to get your temperature. So your temperature, ma'am, is 36.5 and that is also normal. Okay. So did you have your laboratory test, hemoglobin or urinalysis? So
None.
okay, so ma'am, if you didn't go for a laboratory test, I suggest that you will go. Okay, so let's now move on. So it is your first month period. So I'm going to check if you're anemia. So you have no anemia, swelling. So mom, do you experience difficulty of breathing?
No.
Mm. Do you sometimes have a blurry vision?
No, sir.
Okay, so do you have severe dizziness?
No.
Okay, so severe headache.
No.
Okay, so do you experience severe vomiting?
No.
Okay. Do you experience severe abdominal pain?
No.
Okay, ma'am. Okay, ma'am. Do you have a vaginal bleeding or spotting?
None.
Okay. Do you have vaginal infections or problems?
No, also, sir.
Okay. Do you experience itchiness?
None, sir.
Okay. Discharge like fluids on your perineal area?
None.
Okay. Others, do you experience some unusual on your perineal area?
None.
Okay, so do you have a painful urination?
None.
Okay, so do you experience convulsions or loss of consciousness sometimes?
None.
Okay, so mom, uh, uh, we as you are a this is your first pregnancy right now,
Yes.
so I suggest that you will have a tetanus toxoid immunization. This will help you on your um, this will help you on your health that you will not be infected.
Okay.
So okay, you will your first dose as early as possible during pregnancy. Okay, so maybe 5 months you may start, and then that your second dose is after 4 weeks. So today is November, so you can take your first dose since November 4. So next is on December, you will have your second dose. Okay, and then after 6 months, so January, February, March, April, May, June, that is your third dose. And then the your fourth dose is after 1 year, and your fifth dose is after 1 year also. So this is very important, mom, so that you will not be infected. Okay. So your date of visit is November 2, 2025. Okay, so today is your first visit. So you if do you have health problems?
None.
Okay, so if none, and then if some cases soon that you have health problems, you may come here at the clinic, and then you can have your complaint that we will see. You can visit on your first trimester. You have to visit the clinic the first month, your second month, and your third month. And your second trimester, visit at the fourth, the fifth, and the sixth month. In the third trimester, the seventh, the eighth, until your ninth month pregnancy. Okay, so mom, I'm going to ask something. So did you have an oral health checkup?
None.
Okay, so I suggest, mom, that you will have to have this oral checkup, so that this will help you on your pregnancy, because sometimes when we have a toothache, this can trigger our pregnancy. So this is a very important matter that you will need to have an oral health checkup. Okay, so uh, when you will give birth to your baby, the proper or in your during your pregnancy, you check your breast. So check your breast, if the nipple of your breast, if is it what's this, inverted or not. And because this sometimes give nagdudulot ito ng hindi kaaya-aya sa ating baby. So you need to examine your breast also. So, and then the size, and then next is your check for a sputum examination. So you need to see the signs and symptoms of tuberculosis or any disease. And
Yes,
then, yes, and other, uh, do other examinations also. Okay, here, ma'am. So, today I am going to teach you or give you an advice on the newborn screening. So, or the breastfeeding. So, in breastfeeding, ma'am, when your child is born, you place the baby. You can hold the baby like this, and then you insert the nipple inside the mouth of your baby, and then you check if he is sucking, uh, he is sucking properly, and then you will observe if your baby is drinking or not. Okay, so your next visit, we will counsel you on your proper nutrition. So, and until we finish it. Okay, so we finish the breastfeeding. So on your next visitation, we can have proper nutrition counseling. Next is family planning counseling, and the proper personal hygiene and self-care counseling. Then discomfort in pregnancy counseling, reduce workload, exercise, avoidance of cigarette smoke, alcohol intake, substance abuse, and others. And also other interventions until the next of your visit. Okay. So your next visit is on December 28th. Okay. So, what is your attendant during delivery? Sino po ba yung magpapaanak sa'yo?
Dr. Dumon.
Okay, so si Dr. Dolawan po. Okay, so saang hospital po ba kayo comfortable na mga
Maybe in the Tanakdapan.
okay, Tanagtapan District Hospital. So, that is public, right? So, ma'am, do you have a PhilHealth?
Yes.
Okay. Do you have other financial scheme?
Yes.
Okay. So, if yes, please specify.
SSS.
Okay. Okay. So, what is your available transport to be used?
Okay, we have the van.
In the van. Okay. So, who will accompany you to your
My husband.
okay, my husband? Okay. Thank you, ma'am, for coming. Thank you for visiting our clinic. So I advise that you will come next time so that we will go for further interview. Okay, so that's all for today, sir. Thank you and God bless.